Now, we promised you this interview. South Africans and people around the world have wrestled with mental health issues during the COVID-19 pandemic. Now the temptation to throw up our arms and not wear masks and not follow guidelines has a name: caution fatigue. Caution fatigue is believed to be contributing to rising cases in Canada. Let's look at the implications here. We're joined by clinical psychologist Khosi Jiyane. Ms. Jiyane, thank you for being with us. So caution fatigue, is that a term being used informally, or is it really a part of the medical parlance, I guess, already?
I must say, for me personally, it's a term that's kind of finding its way into our parlance at the moment, because, of course, we've never really been thrust into the time that we are finding ourselves in. So we are needing to either reinvent or re-invoke language from previously, where such experiences have happened, but nothing to the extent to which we are finding ourselves at the moment. We are not our language as well.
Is there any precedent for this? I mean, like you say, I guess COVID-19 has just gone on and on and on. I think I'm tempted to throw up my arms sometimes. It just gets exhausting. What are the psychological reasons behind caution fatigue?
Well, it is simply because the time we are finding ourselves is unprecedented, right? And we kind of have within us as human beings, as part of our inborn survival mechanism, the capacity to adapt to situation. However, there's also within us a need for some sort of predictability to life, a sense of knowing, a sense of being in control of what's going on, so we can plan our lives accordingly. And where we are finding ourselves at the moment is this continuous roller coaster. And at this point in time specifically, we are at a point where we're kind of fatigued. That's the other, the more common word, that we are fatigued because it is just our coping resources are being depleted and we are just done with this. I was reading an email from somebody today who said, I'm just done with this. I can't deal with this anymore. And that's the language that everybody is experiencing. And people just get to a point where they get so overwhelmed that they numb out. Yeah. And so that's why we say, we're seeing people, there's actually, there's no unilateral direction in which things are going. So on the one hand, people are gone past the stage of rejection, of resistance, and people have accepted and embraced. This is where we are for some people. And I think everybody on some level wrestles. We are in and out of this, where on the one hand, we can become comfortable and accepting and say, okay, let me buckle down, let me knuckle down and just do this. But there's times when we've just had enough. And we go into the opposite force of resistance and rejection.
And I guess the problem is you can be done with it and then you put yourself in danger or somebody else in danger, and then you have all the fallout of that.
Indeed, because, we are only just one breath away from a wrong move, so to speak. And because we are fighting an invisible enemy, and there's very little that we can do. I mean, there's a lot, but there's very little as well, because it just it just has interrupted the fiber of our social existence. We are social relational beings. And if you ask us not to do that, who are you asking us to be? What are you asking us to be? And so as humanity, we are confounded with what it means to be a human being at this particular time, when the very things that define being human are the very things that are putting us at risk, individually and collectively, of course.
So do you have any advice for people who just feel tired? I know some people have been saying stop clinging to the idea that things will go back to normal. And I've been guilty of that. You wait for things to go back to normal. Do we just suspend that? And then how do you live with the uncertainty of where things are going?
There are no quick answers to this, unfortunately, and it is one of those bitter pills that we are needing to swallow at the moment. And it is about constantly reminding ourselves that this is in my own best interest, and for us to kind of take a cost-benefit analysis that says, would you rather live with this inconvenience than the inconvenience of infection? And it might help, for us to experience and hear from people that have had serious experiences. I mean, I've just got a client whose whole family was hospitalized. Only yesterday, she came out of ICU first and then was discharged yesterday. And the messages she's been posting today of her journey, and just, she's begging people. And sometimes it takes people like those to remind us, because maybe we get into this lull about how serious this is until we kind of need that jerk kind of back to reality of this.
And of course, it's complicating things now that seemingly the vaccines don't even stop people spreading the disease. So we thought that was the panacea.
Absolutely.
No, it's not. What about, I mean, it's so hard, Ms. Jiyane, finally, because yes, you can be so cautious, but at the same time, you can have kids and you can stop them seeing other people, and you can know that there's going to be psychological damage because of that. So you're between a rock and a hard place.
Indeed. It is literally a rock and a hard place. And, the fact that there's still so much controversy surrounding the scientific world. We hear from competing sides of what are supposed to be experts on this. 1 minute you hear that there's a particular thing that might mitigate, that might help, and then you read other, reports in scientific journals to that effect. That say the contrary. And so as people, we are just literally flung in different directions. And the simplest thing is to come back to the basics, regardless of all the other things that might unfold. What we know for sure and can hold on to and is within our reach is the very simple, basic steps that we need to take. Simple yet complex and complicated. Remembering also, of course, that if we put ourselves at risk, we equally put other people that we care for at risk. And so it is still an unprecedented time.
Yeah.
And so we just have to one step at a time and not think about long term and just focus on the immediate. What is it that is within me to do in the now? And it is only in the now that we get to the next now sort of thing.
All right. Thank you so much, clinical psychologist Khosi Jiyane. Now, in a surprise move,